My name is Ken Wood. I'm a 1977 graduate from the Western College of Veterinary Medicine, Saskatoon, and since then I've been involved in mixed and now the last 20 years exclusively large animal practice in rural Saskatchewan. I've always approached success in business in an oblique fashion. Like, instead of focusing on just, making money and being a good businessman, focus on being a good veterinarian, being a caring veterinarian, giving good service. Prosperity will follow after that. This idea of the image of the kindly veterinarian, that's a very powerful image. The first annual general meeting of the Saskatchewan Veterinary Medical Association took place in August of 1909, and there was 56 veterinarians signed the registrar. Now, that doesn't sound like much, but if you think about it, this was the dawn of the automobile age. Like, asphalt hadn't been invented yet. The first veterinarian to come out to Western Canada was a fellow named John Luke Poet, who was part of the March West by the RCMP to establish, bring law and order to the prairies, if you will. Of course, the veterinary profession was mostly concerned with horses because they were the principal source of power. The tractor came along and sort of displaced the horse. Then the profession was focused more on food-producing animals, cattle and sheep and pigs and so forth.
I'm Dr. Laura-Lee Sarita. I graduated at the Western College of Veterinary Medicine in 2012. I currently work in a companion animal practice in a small city in Saskatchewan. I love being a veterinarian. I love the delivery system we have. It is an excellent model for delivering healthcare to our patients. Most veterinary practices have in-house laboratories, high-speed dental equipment, digital x-rays, ultrasounds. They get their results of their blood tests and their ultrasounds and their medications all in the same place and usually in the same day, if not an hour or so later.
My name's Debbie Hoopka-Butz. I'm a veterinarian in a mixed practice in rural Saskatchewan. When I graduated, it was mainly a male-dominated profession. So females were not a commonplace, so when I came to rural Saskatchewan to practice, I had to earn the trust and respect of the ranchers and farmers. Small animals have come a very long way since I first graduated, but a lot of rural practices now have in-house labs, digital radiography, ultrasound, so our diagnostics are so much better. We're finding diseases and things that we probably didn't even look for when I first graduated. The quality of care has improved a lot. Pain medication, we're much more conscientious of that. We don't just send an animal home post-surgically without making sure they're comfortable and happy. We are in that way able to extend the life and the health and happiness of that pet for the owner so that their companion animal can live a longer, happier life.
My name is Bianca Bauer. I'm a veterinary ophthalmologist, and I currently work at a specialty center in Saskatoon, which is known as the Veterinary Medical Center, and it's part of the Western College of Veterinary Medicine. We've seen that pets are becoming more family. It was even me growing up in my high school years and even university, our dogs were outdoor dogs and certainly part of our family, but a little bit different. They weren't allowed in the house. And that is changing quite a bit. It is very true that the pets are part of the family and they are in the house, they're in the bedroom, they are really valued as children essentially to a lot of people. And so that bond, that human-animal bond is, I think, becoming stronger and stronger as veterinary medicine and even as the years go on, absolutely. One particular case that I find entertaining and definitely very rewarding is a dog, a little pug. His name was Mojo, and he had come in several years ago, I would say now, and he was blind from diabetic cataracts. And the owners were a young couple, and they wanted to provide vision, and they were able to do cataract surgery for their pet. And Mojo left the hospital after cataract surgery and went back to the hotel. We rechecked them the next morning, and I asked them how Mojo did overnight, and they said he did extremely well. And they said, but they didn't sleep all night. And I was concerned. I thought there may have been something wrong with Mojo in his eyes, and they said, no, he didn't leave the mirror from the hotel room all night. He stood in front of the mirror looking at himself, different angles, and was admiring the new view that he had.
So my name is Dr. Duncan Hockley. I'm the director of the Veterinary Medical Center at the Western College of Veterinary Medicine. It's interesting to me to think about some of the most profound changes that we see within the veterinary medicine, and I reflect back onto my career, some of the very first days where I would ride with Dr. Harry Struthers when I first graduated, and some of the characteristics that he has provided to me, meaning good customer care, quality of service, still are so valid today. But looking at some of the things that have changed so much with the availability of the diagnostic tools, the medical imaging, it's really impressive, and the ability of some of that technology that has been incorporated within the veterinary medicine and provided us avenues for increasing our ability to treat and mitigate disease. One of my most favorite parts of my job working within the referral hospital setting is seeing that interaction with the family veterinarian, addressing some very difficult situations and working within that hospital environment and bringing that team together to deliver a good end result to a difficult problem.
I don't know if you want me to say that. The favorite part of my job, I'm asking you more so, is working with the people. I love working with the animals, but ultimately working with the people.
My favorite part of my job as a veterinarian would be just dealing with the people and the animals.
I love working with the people and their reactions of, how amazed they are when they get their results to their blood tests or x-rays within the hour.
My wife articulated it best, I think. Hanging out with critters makes you a better person. So along with the relationship with animals, it's the people that own these animals, to me, are the best people in the world. It's just been the best part of my career, I think.